Hey guys, it's Cade. What's up? It's October 1st, 2009, so this is my 1 year and 5 days on testosterone. Um, wow, yeah, lots has happened in a year. I'm very happy with the changes that have been brought about. Testosterone works quite fast. You know, I've seen a lot of guys get facial hair quicker than mine. Mine's just starting to appear. It really just started coming in very little, minimally, a couple months ago. I've got an okay little dirt stash and beard now, so I'm happy with it. I mean, I just saw a video the other day of a guy who had a full beard within 6 weeks. Of course, he had facial hair before he ever started testosterone, but it was really crazy to see him masculinize so quickly. Um, as for other changes that I've noticed over the past year, well, my shoulders have broadened a lot to the point where almost nothing fits anymore. Arms got very muscular very quickly. Um, Legs got muscular very quickly, and fat redistributed off my hips and legs to my stomach. I'm a pretty big guy, and I'm cool with that. But it was quite interesting to see muscles appear where they never have before. So um, that's awesome. Muscle gain happens much more quickly on testosterone when I am working out or working in the kitchen at work. I'm a chef, so yeah, it comes a lot more quickly. Also, lots of fur on the stomach and the legs were the first things to come in on T. Then the arms and the back, and we had this joke, me and my girlfriend, with people, who asked how it was going, and I said, every month there's a little more fur on my stomach, and it's above the navel now, and it's creeping up, creeping up, creeping up a centimeter a month or so. Like, it's going up, it's hit my chest. Eventually, it'll hit my face. So that was our running joke. We've enjoyed, the changes, going through everything together. My girlfriend, she gets really excited seeing changes with me. So that's been really great to have someone who's really supportive in this with me, and get as excited as I am over everything that's happening. So that's pretty, for physical changes, just a lot of broadening in the shoulders, torso starting to become a bit of a V shape. Things are changing um, all the time, and lots of hair for sure, lots of fur. I hope I can grow a full beard one day, and if I don't grow any more hair on my back or arms, I'll be a happy camper. But I'm sure that's not how it'll go. So you know. As for cognitive and emotional changes, a few interesting things. I stutter more. I fumble for words more than I used to. Sometimes when I'm speaking, I feel a lot less articulate. And earlier on the testosterone, I found it very hard to organize my thoughts, to be able to speak clearly and coherently. Um, when I look at some of those videos now, it's funny because uh, I just find that I have trouble organizing my thoughts when I first went on T. It's gotten better over time. Tried to sort of read lots and really give a lot of thought to how I speak, so that uh, it doesn't look like an impairment, if you will. I don't know. It's been funny to try and figure out about why that's happening. Another thing is when my girlfriend asks me a question or speaks to me, sometimes there's more of a delay. It's like I'm processing information and I can't quite answer her right away. So, but does testosterone make you stupid? No, I don't think so. Because certainly my academic writing hasn't suffered, and thank goodness that writing's controlled by a very different part of the brain than speech, because I'm still as articulate as ever and as thoughtful as ever and as diligent as ever in my writing. So that's good. Um, yeah, I don't know. Other changes. Adam's apple has kind of come in the throat. When I touch my throat now, I feel a lot of cartilage. hardness that wasn't there before. That started happening months ago when my voice was cracking and dropping. I noticed my first voice changes around month 1 or 1.5 on T. It was around the same time that I never menstruated again. That goes away very quickly. It's something guys don't like to talk about, but for people who are thinking about going on T, you can look forward to losing, your monthly cycle within 1 to 3 months is typical. And yeah, my voice started changing around that time. And then by month 4, you can see in the videos it really started to drop significantly. And then it tapered off a bit. It started to drop more slowly. I'm sure it's lower now than even in my last video, but I don't know. I'll have to go and see. But yeah, so lots and lots of changes. It's so systemic. I find myself completely in awe of everything that testosterone's able to do for me, and it's been really wonderful. Energy's been really good. Libido's been really good. Generally mood has been excellent. I often say that, transition saved my life. Really, to put that in a more concrete way, testosterone did for me this year what SSRI antidepressant drugs were never able to do. And I've used all kinds of street drugs and alcohol in my life, and they never could do for me in terms of mood stabilization and affect regulation that which testosterone has given me this year. So there's been a tremendous amount of joy and happiness and really peace. I feel like I can regulate my emotions much better than I ever could before. So that's really great. Yeah. Other than that, I have a great piece of news. I had a psychiatric assessment by 2 psychiatrists that work with MSP, which is our medical services plan in British Columbia, Canada. It's the government medical insurance that all citizens have here in my country, and this is our provincial one. And the government then appoints 2 psychiatrists, and only these 2 psychiatrists' opinions are valid in the matter of gender identity. And specifically, these 2 must assess one who lives here for any sort of funding for sex reassignment surgery or gender confirmation surgery or whatever you want to call it. And I wasn't going to apply because it was my understanding that in terms of top surgery, they would cover 20% or less, and I didn't want to put myself in that situation of having to see government-appointed psychiatrists for something like that. I thought, well, I'll just pay private. But then I got word a while back from a friend that, in fact, no, there is one surgeon here. You don't get to pick. That's something to be said for the private pay system. But all the same, I don't really know when I'll have $8,500 spare money being a university student who works part-time. I can't see top surgery being feasible, and also in a few videos back I made this, well, I'll get to that in a minute. But anyway, I went to the assessment with these 2 assessors, and it was like a big, scary, formal assessment, and I thought it went all right. They are very rigorous. They ask you a lot of questions, things you really never want psychiatrists to ask you. But they concluded at the end of the 45 minutes that I'm a good candidate for SRS and or GCS or whatever, and decided that they would give me 100% funding for my top surgery. So, big changes. I agonized and wondered how I would save the money, and I feel really blessed that this has happened. So, it's an 18-month surgical wait list versus a private pay plastic surgery clinic. You'll wait 4 to 6 weeks in this area of the world. But all the same, it's a way of practicing patience, and it's so great to know that it is in fact paid for. So that's my great news about top surgery. And I hope everyone is doing well, and I'll make another video somewhere down the road. Oh yeah, and also got a date for hysterectomy in May, so that'll actually be done first, and and the province is paying for them as well. So take care, everyone.